Could you be one of the 1.2 million Australians living with coronary heart disease and not even know it? Hi, I'm Dr. David Tran, a cardiologist with over 10 years of experience. I've helped countless patients prevent, manage, and also treat their coronary heart disease. In this video, I'll share that knowledge with you so that you can take control of your own heart health. Specifically, you'll learn how to recognize the signs and symptoms of coronary heart disease, which risk factors you can control to lower your chances of developing the condition, what lifestyle changes can help prevent or manage coronary heart disease, and also what treatment options are available if you or a loved one are diagnosed. Coronary heart disease occurs when the arteries supplying the blood to your heart muscle become narrowed or blocked due to plaque buildup. This process is called atherosclerosis, and it reduces blood flow to your heart, potentially causing chest pains, shortness of breath, or a heart attack. Several risk factors contribute to coronary heart disease. Some are controllable and some are not. The controllable ones include unhealthy eating habits, especially consuming too much saturated and trans-saturated fats. These fats, found in animal products and processed foods, increase our LDL cholesterol production, which is known as the bad cholesterol, and that leads to plaque formation. Physical inactivity, obesity, smoking, and other conditions like diabetes and high blood pressure also increase the risk. The uncontrollable risk factors, which you can't change, include your family history, age, ethnicity, and gender. Men, postmenopausal women are at higher risk, as well as certain ethnicities. So, how do you know if you have coronary heart disease? These are some signs and symptoms to watch out for. Common symptoms include chest pain, shortness of breath, or reduced exercise tolerance. Sometimes it can be quite subtle. It can be a tightness in your jaw, in your chest, in your shoulders, neck. If left untreated, coronary heart disease can lead to nasty complications, including heart attacks, where there's a complete occlusion of the heart artery, heart failure, where the heart muscle is weak and unable to pump adequately to the body, arrhythmias, an abnormal heart rhythm, and most devastating is sudden cardiac arrest. Fortunately, with our modern medicine, coronary heart disease can be managed and there are several treatment options. However, of central importance is the management and adoption of a healthy lifestyle. Eating a heart-healthy diet that's low in saturated and trans fats, high in fruits and vegetables, whole grains, and lean proteins will help. Increasing your physical activity, maintaining a healthy weight, quitting smoking, and managing stress are also important. Your vascular risk factors, such as your blood pressure, cholesterol, and blood glucose levels, these are also the same risk factors involved in stroke and peripheral vascular disease. Monitoring and controlling your vascular risk factors are important in preventing heart attacks and the development of new coronary atherosclerotic plaques. Medications also play a role, and they will work synergistically with those lifestyle measures. It's not in place of those lifestyle measures. There may be a combination of medications to help control your vascular risk factors. There might be medications to improve your symptoms associated with the coronary artery disease. You should keep in mind though that these medications are not one size fits all, and what works for one person might not work for another. Your doctor will work with you to determine the best medication or combination of medications for your specific needs based on factors like your age, overall health, and how bad and the severity of your coronary heart disease. In some cases, invasive procedures like angioplasty, stent implantation, or even coronary artery bypass graft surgery may be needed. Cardiac rehabilitation programs are also very helpful in managing the condition. We do this through exercise training, education, and counseling. So, to wrap it all up, coronary heart disease is a serious condition, but the good news is that it can be managed through a combination of lifestyle and medical treatment. If you'd like more information about heart disease or need to consult with a cardiologist, please visit my website at www.connectcardiology.com.au. Thank you.